Hi, I'm Dr. Lori from the Aphasia Center in St. Pete, Florida. If you haven't heard about the Aphasia Center, it's an intensive aphasia program that I started about 15 years ago. One of the main reasons I started this center is because there are a lot of people with aphasia who get discharged from therapy without any hope, without having made any real progress, or without any idea of what they're supposed to do next. And it's very frustrating to hear that same story over and over again. So we give you the opposite experience. So we specialize in aphasia improvement, giving you hope, educating you about your aphasia and why things are the way that they are. But more importantly, we give you a plan so that there's always a next step for you. So people want to know, what kinds of skills can I work on in an intensive aphasia program? The overall goal is for you to become more independent and need less help to communicate over time. So once we've established exactly where to start, we can teach you anything from how to text, how to better communicate with your family, understand conversations, read and write faster for work, say more words, speak in longer sentences, faster word retrieval, basically anything that you want to work on because your goals and your treatment are very specific to you. And it's important to know that it doesn't matter how severe your aphasia is or how long it's been since your stroke or brain injury. We have the expertise to help you with your speech and language skills, and more importantly, your confidence. So even if you can't say any words, all the way up to you are back at work or going back to work or college, and most people who meet you may not even know that you have aphasia. So we have the expertise to help you with a wide range of experience. We have 3 types of programs that I'm going to talk about briefly in order of best outcomes. So the best outcome, or the best way to make the most progress, is to come on site for 4 weeks in Florida. It's 27 hours a week, so that's about 108 hours of therapy. The second best option is to come to Florida, but only for 2 weeks. This is our hybrid program. Then you go back home and continue intensive therapy online at your home for 6 weeks. That's a total of 114 hours of therapy. The third best option would be to do all of your intensive therapy online at your home for 6 weeks, which is 60 hours of therapy. All of our programs include assessment, training, education, and your plan. There are also additional therapy options once you're done with the intensive program so that you can keep making progress on a lesser intensity. Our goal is to figure out how we can help you even if you have limitations. So you'll hear about one of these projects next week before the final session. If you want more information about the intensive program in the meantime, you can go to our website at theaphasiacenter.com. Here you can find case studies, so you can look up people who have been through the program that may be similar to you and see what progress they made. There's also videos for caregivers. We have free aphasia communication tip cards that you can hand out. We have a printable aphasia wallet ID card in Spanish and English. And we also have printable articles on aphasia. So we want to help you in any way that works best for your goals and situation. So even if you don't think intensive aphasia therapy is for you, we may have suggestions that will better fit your needs. Thank you all for watching, and I want you to remember that there is no plateau in aphasia. You can always keep getting better.